Welcome to the Health Science Podcast, sponsored by the National Health Association. I'm your host, Dr. Frank Sabatino, and I'm absolutely delighted today to have Dr. Debra Shapiro with me. Debra is a board-certified doctor in obstetrics and gynecology. She's also a diplomate in the Board of Lifestyle Medicine, and even went further to study with a good friend of mine, Victoria Moran, and become certified as a vegan lifestyle coach from the Main Street Academy in New York. Debra, I'm so happy. Welcome. Welcome to the Health Science Podcast, brought to you by the National Health Association, the oldest organization in the world championing the extraordinary benefits of a whole plant food diet and healthy lifestyle, as well as water-only fasting. We believe that health results from healthful living and focus on evidence-based science that promotes the health of you and your loved ones, as well as the health of all animals and the environment. We feature experts from a cross-section of disciplines within the plant nutrition, vegan, psychological, environmental, and animal compassion sectors. I'm your host, Dr. Frank Sabatino, the NHA's Director of Health Education.
Thank you so much, Dr. Sabatino.
I'm going to start off with a little anecdote that I think you'll appreciate. Many years ago, when I was like a fledgling doc coming up, I met Dr. Bob Gross, who ran one of the largest fasting institutions in upstate New York. Being the nice Jewish doctor that he is, he loved me. And he said, you know what? I know your name's not Sabatino, it's Shapiro. So here I am meeting the real Dr. Shapiro. So that's what we
That's a very funny story.
Bob had a great sense. He had a great sense of humor, and he was always kidding all the time. Debra, I know that over the past 10 years, I mean, you practiced for a long time, dealing with women's health issues and so on. And over the past 10 years, you really got more into the whole vegan lifestyle and the plant exclusive way of turning people on to what they can do to help themselves. Was there a turning point, an aha moment that really propelled that? Can you share that story with us?
Yes, absolutely. I was just going to say that in my family, there are a lot of Dr. Shapiros. So
I'm sure.
Yes, but that is a funny story. I was a vegetarian for 10 years when I was much younger, from 17 to 27, for the animals, and I didn't know anything about the dairy industry or the egg industry. I was just a lacto-ovo vegetarian. And then in the middle of medical school, I developed some food intolerances and some irritable bowel. And I really fell off the wagon in terms of caring enough. It was more about just trying to survive. And I didn't know what to eat. And I was confused. And I was so it was back to turkey sandwiches and things like that. And then as a physician, I really lost track of where I wanted to be and became sort of a foodie. And I think it was also partly because the people I hung out with, nobody was plant-based at that time. And so for many years, that was what was happening. And my blood pressure was going up, and my cholesterol was going up, and my weight was going up. And I didn't really think much of it because I was just working super hard as a private practice OBGYN, trying to deliver all of my own patients. So it was a very stressful life. And then a patient came to me with mercury poisoning and from eating too much fish. And I realized that I also had mercury poisoning. I was tested and my mercury level was also high. So I had this sort of introduction to this idea that some of the food that I was eating was actually not healthy for me and actually maybe full of poisons. And then it was actually a patient who came to me, a vegan patient, who told me initially about Farm Sanctuary. And I went to visit Farm Sanctuary, and I went to some of their events, and I really opened my eyes again about, it was sort of like an aha moment about what I had really lost track of in terms of my compassion for all living things. And that same patient came back to me the next year, and she told me about Michael Greger's work. So I really owe it all to her, because that's when I started learning about the science of plant-based nutrition. And I saw a Cowspiracy at a Veg Fest, and then it all came together. And I threw myself into educating myself about plant-based nutrition. And I got the T. Colin Campbell course, and I started going to conferences like the International Plant-Based Nutrition Healthcare Conference and the ICNM from PCRM. And I just kept reading as much as possible. And there were some trials in my personal life. I was embezzled. I lost my practice for a while. And I had to really reinvent myself in terms of how I wanted to practice, or whether I wanted to practice, and in what was I going to do in the meantime. And so I became a coach. And being a coach is very different. Being a health coach or a plant-based health coach is very different than being a doctor. As a doctor, I just tell people what to do. And as a coach, I really have to get them to see what they need to do for themselves. It's very different. And sometimes it's a little tricky. So I do both. I'm a doctor at Genentech in their health clinic, and luckily we practice lifestyle medicine. And then I'm also a private health coach.
In the work, though, in terms of the practice, so when you got turned on to this way of thinking and living, you weren't really integrating that into your OBGYN practice. That was really something separate from your personal study. But now subsequently, do you deal with obstetrics and gynecological issues that way? Is that something you still kind of do in your lifestyle now?
Absolutely. So in my private practice, I was just learning, and I was trying to get my hospital on board. I put on an amazing conference, full-day conference in 2015 before I left. And really, I brought in Michael Clapper. I brought in lots of speakers, Juliana Heber and Michael Clapper and Neil Barnard. And I had incredible people come and speak. But I tried to get them to have healthier food, to get rid of the bacon, to pay attention to what was going on with the AMA and processed meat. And I just it was very difficult. It was very difficult to get them to move. And actually there are some examples that I could give you, which are very sad, about doctors who just weren't ready to hear what I was trying to tell them. And so when I told patients about what they could do and what I had achieved, lowering my blood pressure, lowering my weight, lowering my cholesterol, all of this, not needing to go to the chiropractor as often, not needing the antihistamines regularly, not having weekly headaches, all of this. I'm not sure I knew enough then. It was a while ago. It was 2000 and I left my practice in 2015, 2016 when I was embezzled. When I went to Kaiser for a little while, there just wasn't enough time. Yes, they embraced lifestyle medicine ever since 2013 when that Permanente Journal article came out. But in day-to-day practice, you only had a few minutes with a patient, 15 minutes, and it wasn't enough time to really do that. So you would send them to a health coach, and luckily they had health coaches. But still, their diabetes educating program for pregnancy still considered lentils a carb and had to be counted. So no, I don't think they were even fully on board at the time. But where I am now, we practice lifestyle medicine, and we ask very extensive histories on how many servings of fruit do you have, and how many servings of vegetables, and how many hours of exercise, and what kind of exercise. All of this has gone over, and I have lots of time with patients.
Well, Debra, you intimated that when you were doing this, you got some resistance from colleagues. You said there were some stories. I mean, how brutal was that really for you? How much of a stress really was that for you?
Well, it was horrifying. It was horrifying because I would go when I had conferences, when I was putting on, I would have grand rounds and have, one day I had Neil Barnard giving a grand rounds, and there was a cardiologist who came up to me outside. I was trying to get people in the room, and he came up and he just said, "Oh, Debbie," it's kind of a diminutive, right? So, "Oh, Debbie, you're so naive. It's too extreme." He was a cardiologist. And I've had other cardiologists say, as I would leave the room, I would be walking away from them because it was just ridiculous. And they would say, "I bet you don't like eggs either." I mean, it was like, but the worst story, if you want to hear, I think this is a really sad story, but I was in the operating room, and sometimes, between cases, you would just sit and wait. And one day I was pulled into a case with a vascular surgeon who I liked. He was my father-in-law's vascular surgeon. I liked him, and he wanted me to assist on this fempop bypass. I had never done any kind of vascular surgery, and I was just holding a retractor, and he had cut into this vessel, and he was pulling this gunk out. It looked like chewing gum. It was quite new to me, and I said, "Look, Dr. G, this is why you should tell your patients about a plant-based diet." And he said, "Yeah, look, this is why I shouldn't." So the sad part of this story, the epilogue to that, is that this doctor developed Crohn's disease, and he didn't want to change his diet, and he went on Humira, and he got lymphoma, and he died at a very young age. And I have actually reversed Crohn's in a client and gotten her off her Humira, even when her doctors were saying, "Oh, you'll never be able to get off your Humira because you'll have a like a flare, and there will be no way to treat you." And she's been off her Humira for years now. And doing great.
Through the history of the NHA and all the docs that have been doing fasting and all of that for so long, the autoimmunes are so responsive to just those kinds of interventions followed by whole food plant-based, and people get off biologics all the time. And it's sad when you watch that and you know that there's something that could be done to prevent that kind of devastation down the road, in this doc. It's really unfortunate to hear, but we see it every day because of the resistance to embrace the kinds of things that we're talking about. Debra, let me ask you a question. When you're taking care of people, and suppose you had somebody that was going to give birth and they're dealing with prenatal evaluations and nutrition and all that, do you have any good relationships now with people that are going to actually deliver babies and you take care of them prenatally? Do you have that kind of dialogue that goes back and forth now?
Right. No, actually, right now I have a coaching program with Jean Schumacher called the Pregnancy Advantage, where
I'm going to talk to you a lot more about that for sure.
But in terms of being a physician, so that's being a coach, but being a physician, I'm limited at Genentech in their clinic to only doing general gynecology, very general gynecology and lifestyle medicine. And then I can do, preconception care, but once they're pregnant, that's very important.
Well, tell me, define that routine gynecological care. What is that?
So someone comes to me and they say, and I'll ask them, because let's say they're in sort of an age range and they haven't had children, and you're thinking, what are you thinking about having children? And they say, yes, I'm thinking about getting pregnant in the next year. So then you say, well, let's have a conversation about all the ways that you can improve your health now so that you can improve your fertility, have a healthier pregnancy, an easier delivery. You'll be healthier later on in your life and you'll have a healthier child.
Oh, we're gonna take a few seconds of a break to hear from our sponsor, the National Health Association. I'm here with Dr. Debra Shapiro, and we're going to come back and talk about some elephants in the room for women's healthcare that I really want to get into with her. So we'll be back in just a few moments. And now, to put a smile on the sponsors of the National Health Association, you're listening to the Health Science Podcast Show. I want to remind you to visit the National Health Association website, where you'll find incredible resources to support your healthy lifestyle, including plant-exclusive eating without added salt, oil, and sugar. Simply go to healthscience.org or nationalhealthassociation.org. Be sure to check out membership, which is $35 per year for those living within the U.S. and $55 for those living outside the U.S. You'll be amazed at all the information and benefits you'll receive. As a member, you're kept up to date on the latest evidence-based tools for health promotion. You'll receive the incomparable quarterly magazine, Health Science, a beautiful 40-page advertising-free publication mailed to your home or offices, loaded with articles, recipes, inspirational stories, and interviews with world leaders in the fields of personal health, plant-based nutrition, water-only fasting, animal rights, and environmental support. And you'll receive details about life-changing events, such as the 2023 NHA Conference set for June 23 to the 25th, 2023 in Cleveland, Ohio, which will be the NHA's 75th annual NHA Conference. I'm your host, Dr. Frank Sabatino, and now back to the show. Welcome back to the Health Science Podcast. I'm here with Dr. Debra Shapiro. Yeah, so let's talk, women especially really, the knowing that they have access to someone like you. I want to touch on some elephants in the room about women's healthcare that I think your professional opinion would have tremendous weight and value, and I think it'll really help the female audience that's out here. Number one, we still, after all the information on phytonutrients and isoflavones, we still have that huge controversy about soy products and soy protein being involved in promoting reproductive cancer. Why don't you address that from your knowledge base? Yes, absolutely. This is also quite distressing because I've had friends and acquaintances and people that I've talked to on Facebook and around who have been diagnosed with breast cancer or at risk for breast cancer, and they've been told by their oncologists or their doctors or their friends or wherever on the internet that they shouldn't have soy. And it's very, very sad. And some of them have, even because they've refused to have soy, they haven't changed their diet and they keep having dairy and they keep drinking alcohol and not really making the changes that they need to make. They've had recurrences and they've even died because of that. And
it's very sad. So I think some of the studies on soy that started all of this controversy were done on rodents, and rodents react very differently to soy. But it turns out that the phytoestrogens, the plant estrogens in soy, act as a SERM, a selective estrogen receptor modulator, like tamoxifen. So instead of sitting in the alpha receptor in our breast that increases growth, they sit in the beta receptor. There are two estrogen type receptors in the breast tissue, and they sit in the beta receptor, like the SERM, like tamoxifen, and they put the brake on growth. So they actually help to prevent a recurrence. So they also work in a few other ways as well. They work as, it's called an aromatase inhibitor. Aromatase is an enzyme that would take androgens to estrogens. And so and Arimidex is an example. So Arimidex is a treatment for breast cancer, something that we would give people, a chemotherapy, and the soy phytoestrogens act like that as well. They also act to upregulate the genes that are involved with DNA repair. So when people have a BRCA mutation, a mutation in a gene that is a mutation in a gene that is for repairing damage to DNA, even those people who have that BRCA mutation, who are more likely to develop a breast or an ovarian cancer, are going to be helped by using soy. Now, I'm not talking about buying soy phytoestrogen as a supplement, because we don't even know what that is. The whole supplement industry is not really regulated in this country. So you have to be careful about that. I'm just talking about eating whole soy foods. So soybeans, mature soybeans, or edamame, which is the young soybean, or tempeh, or tofu, which is slightly modified, or soy milk. So those are the things that actually can help you to prevent breast cancer, and if you've had breast cancer, to prevent a recurrence.
And supportive of that, and the audience should know that in those countries of the world that consume some of the most soy products, they have the lowest outcome of those reproductive cancers, whether it's Asia or whatever. And so that's always been such a bogus argument that has been imposed in the West, because let's face it, American women are not getting breast cancer from eating soybeans. They're getting it from everything that you've mentioned: animal-based foods, alcohol, cigarette smoking, all the things that can increase the risk for this kind of estrogen dominant effect.
And now we know more about the estrobolome, which is a subset of the gut microbiome that is involved in the recycling of estrogens. And so there's certain bacteria, bugs in our gut that actually make these enzymes called beta glucuronidases. And when you have more of those, then you're going to be recycling and making more estrogen that's going through your body. So the
foundation for that, simple enough, is all the fiber and fruits and vegetables, which is how those organisms ferment what they need to ferment. So it all comes back to that. So with everything you just said, let's go into that epigenetic effect, because when you talk about the BRCA gene, are you someone that if someone comes into you with that history, would you tell them about this epigenetic effect? Because they're so inundated from the medical profession that they need to lop off their breasts, or they need to really go into some extreme form of radical surgery. So how do you integrate that into the way you counsel people that may come to you with those questions?
This is very tough, because I think all of this, there are definitely people in the plant-based world who don't even believe in mammograms at all. I don't know where you stand on this, but it's tricky, because I know of doctors, plant-based doctors, who have suffered from breast cancer. And Dr. Christy Funk, who wrote the book Breast, the Owner's Manual, I'm sure you've talked to her, or you will talk to her. I don't think she's anti-mammography per se, but I think the decision to be tested for different DNA mutations and to see what your risk is, especially if you have a strong family history of breast and or ovarian cancer in a young person, I'm not sure I would feel comfortable telling people not to do something that they really feel that they need to do. That's a very personal decision. But I would give them all the options, and I would certainly tell them that there is nothing to fear from probably 2 servings a day of a whole soy food. And there's probably benefit. But I don't think I could say, just eat soy. You don't have to have a prophylactic oophorectomy if you have. I don't know. I would give them all the information that I have, and I would also have them speak to the geneticist. But I think that's a very personal decision they have to make based on their own.
You kind of sit on the fence with that, really based on the personal history, the person's choice, and all of that. you wouldn't categorically say, you know what, don't take your breast off because we can do this. Let's try that first, see if that makes any difference before you decide to do radical surgery.
Well, I would, of course, but I would give them all the risks and benefits. But I think it is a personal decision, and I don't want to be the one responsible. You don't know really what someone's risk is. It turns out that when a woman's grandmother was exposed, if they've been exposed to DDT, they're more likely to develop breast cancer. So there are things that we don't know about,
right,
epigenetically too. So I just feel like I can't be so sure.
And that's also true of all the environmental inputs like PCBs and all of this that are estrogen mimics and can contribute to those risk factors that you're talking about.
Exactly.
I'm here with Dr. Debra Shapiro. Debra, let people know where they can find you online. How can they follow you? How can they learn more about you and follow you?
Thank you. My website is A New View of Food, just anewviewoffood.com. And there's an ebook that you can download called Why Eat Plants. And through that, you'll also reach the pregnancy advantage.
Yeah, let me go into another elephant in the room related to estrogen and changes in the life cycles of women. When we go through those stages from pre to peri to full menopause, some women will go through hell and back, and some women won't even know that it happened. So, and we know some of that has to do with not only the change in hormones, but the actual absolute value of change. Can you address those, how you have perceived in your experience that shift, and then how you look at the concept, the idea of hormone replacement related to conventional versus bioidentical? Kind of speak to that if you can, from your own experience.
Big subject from my own experience. And I became plant-based around 52. So it was just when I was going through menopause myself, and I had been on birth control pills because I'd had such horrific pain and bleeding. I couldn't really function as a doctor for all those years. If only I had known about plant-based diets before that. But when I became plant-based, I got off of my hormones, and everything was much easier. Everything was easier, and my hot flashes were much better. It was a very interesting study by PCRM, the WAVE study. They took women who are overweight with moderate to severe menopausal symptoms, the hot flashes and night sweats, and they gave them an extra half a cup of mature soybeans every day, along with a low-fat plant-based diet. And then they just watched, and they had an over 80% decrease in severe hot flashes, which is quite incredible. So, and nothing really works other than hormone replacement therapy, I think, works quite that well. I used to give people, if they didn't want to take hormones, they could take black cohosh, for example, but 80% decrease is quite amazing. So the soy phytoestrogens do help. ACOG, the American College of OBGYN, doesn't really recommend anything other than, there are not really any herbs or spices or things that they would recommend. And they definitely don't recommend the, what did you mention? The bioidentical hormones, because they haven't really been tested. So what we have for women who are really suffering is hormone replacement therapy. And the big study that was done, the Women's Health Initiative study that was done many, many years ago, took Prempro, and this is not a vegan product, by the way. Prempro comes from, Premarin, it's from pregnant mare's urine. So Premarin and Provera, which is an artificial progestin, and they gave them to women. And this Women's Health Initiative study was actually set up not to help women with their menopausal symptoms. It was to help to see whether we could use hormone replacement therapy to primarily prevent things like osteoporosis and heart disease. And what we learned from that is that you can't. And that's been reiterated now 20 years later. We're not supposed to use, and we would not use hormone replacement therapy as a primary prevention. Who would have done that? I was never thinking that it would do that. But there were some earlier studies that said that maybe estrogen would help to, lower cholesterol in some way. So just to say that I'm not anti-hormone replacement therapy. There was a long-term study, a long-term follow-up after that Women's Health Initiative study that actually looked like there was no increase. If you're just on estrogen alone, there's no increase in breast cancer. And estrogen plus progesterone, there may be. So if you've already had your uterus out for some other reason, I don't think one has to worry as much. So that being said, all in all, overall, we say if you're having terrible hot flashes and night sweats and you're within the first 5 years of menopause, it is probably safe to take hormone replacement therapy for about 5 years. As you get further along, and certainly if you're at higher risk for heart disease, it has to be reevaluated. So that's something that a person can talk to with their doctor. I think in general that when people are plant-based, they have an easier time, but a lot of it is genetics, and it's about your brain being super sensitive to small changes in temperature. And so you react in a big way, you vasodilate and you sweat and you get hit. So some of it is genetic.
Yeah, let me follow up with that, because back then in those studies, some of the I've actually talked to several gynecology people and some people that claim to be experts in replacement, made the point that because those studies were based on horse-derived steroids like Premarin, Prempro, and all of that, they felt that the human liver didn't metabolize those as well, and that the negative effects that they saw from that may have to do with the fact of the metabolism of. So when it comes to that, as much as they're not tested, do you categorically not go into bioidentical? Is that something you try to avoid?
Well, let's talk about what do you mean by bioidentical? I totally agree with you. And I think it's terrible that study was done with Prempro, with that product. And I stay away from that product, not only because I'm vegan, but I just stay away from that product. But the problem is it'll never be repeated with estradiol or the Vivel-Doc.
Right. There
are lots of estradiol products on the market, and those I do use. But in terms of, there are patients who would come to me and say, I want you to use, go to the, what is it called? The Women's International Pharmacy in Wisconsin and order me this. And it's this combination of estradiol and estrone and estriol and blah, blah, blah. And I have done it, but I don't know if it's really safe to do. I don't know exactly what they're getting. So I would prefer to use, and I do use, natural progesterone, which is called Prometrium.
Right.
And sometimes you could even put in a progesterone IUD if people are young, and an estradiol patch, which is even better because it doesn't raise your triglycerides. It doesn't make the first pass through the liver. So I think that's the easiest, and you could do a really low dose. You can do a really low dose of these patches.
And there's a heyday of popularity for the pellets, as you well know, which I think I like the patch so much nicer than this idea of pelleting women with these dissolvable forms of steroids over time. What do you think about that?
Well, I came after that. I didn't know those. I really didn't. We do have implantable hormones for birth control, like the Nexplanon. And before that we had, Implanon, and before that something else. But yeah, we also have, so there's also a ring that goes in the vagina, but in terms of actually and we use also for birth control, we use Depo-Provera. So there have been these Depo kinds of products that work very well. The Depo-Provera is shot for birth control every 90 days. I know that's outside the scope of this, but for hormone replacement therapy, there's the Femring, and there's a Vivel-Dot, and there's some other, Climera patch. So there's lots of patches. But if that's what you mean by bioidentical, just that it's estradiol as opposed to, an estrone from or an estriol from pregnant horses, I'm all for that. And
I think that's what we're talking about here. Yeah. And let me stay with estrogen, because it's such an incredibly interesting compound and how it functions in the body. The data on Alzheimer's disease suggests that 2 out of 3 people with Alzheimer's are women. And there's a big body of data that has come out suggesting that, estrogen has this neuroprotective, brain protective effect, and that possibly the decline of that may play a role in that evolution of that cognitive decline.
Mm-hmm.
What is your feeling and your take on that data? What do you feel about that?
Wow, I actually don't know that. I've been stuck on thinking about saturated fat as a cause, and inflammation and oxidative stress. So I don't.
Yeah. So well, everything you're saying is so incredibly important, but there is a whole school of thought, because I did an article on Alzheimer's and I had to go through all this, and they really felt that, and the jury's out completely, but the feeling was that the decline in estrogen may have an impact of less protective effect on brain tissue. And that it actually has some impact. The same way, for example, some of the symptoms that women may have with sweats and headaches and other things can be neurological-like symptoms. So they're feeling that some of that may be neuroprotective, but that's fine. Everything you're talking about in lifestyle and in those food choices is so powerful. And I like the fact that, and I think it's important for women to hear that when they stay plant exclusive and they do some consistent level of physical activity and they work with some degree of stress management, they can actually modify that outcome of those perimenopausal or menopausal, changes that have affected their quality of life. So I think that's incredibly important, everything that you're saying about that.
Absolutely.
That program that you got involved in with Gene Schumacher, the Pregnancy Advantage, talk about that, because it was such an amazing approach to help people who are thinking of conceiving or are currently pregnant and trying to figure out what's going to improve the quality of their birth and the birthing, and go into all of that. I think it's just an amazing program.
Thank you. Thank you. It was an amazing program. One last thing was I just wanted to say about the hormone replacement therapy and the estrogen. One of the things we were promoting estrogen was because there were some early studies that showed that there was improved brain function and memory when people were given estrogen. So I totally believe it. But then that Women's Health Initiative study came out and it said that there was no difference. I believe I'd have to go back to look at that again.
We're talking data over the past 5 years now. And you've got to somehow reckon with the fact that 2 out of 3 people with Alzheimer's are women. So how that gender discrepancy evolves, we don't have all that information, but it's a very interesting observation.
It is. All right. About now on to the Pregnancy Advantage.
Yes.
So it was sort of serendipitous that Gene Schumacher reached out to me when I was starting to coach, and said that she was busy really thinking about chemical exposure and how that affects women's hormones and their ability to conceive and the health of their child. And this was something that I only knew about from my exposure to mercury. And so it opened up a whole world of interest. I mean, I started studying about endocrine disrupting chemicals and looking at all different kinds of studies about this and watching different people speak about it, and really learning a lot about phthalates and parabens, and being very annoying to my spouse. Like just the other day, she's holding on to a receipt and showing me this receipt. And I said, throw that away. Don't hold on to that. That's BPA. And she rolled her eyes. So it's very difficult to be in a household with me now because I'm always thinking about exposures. But, BPA it is like estrogen-like, and it's also an obesogen. So we developed this incredibly, I would say, far-reaching kind of program that uses lifestyle medicine, all the pillars of lifestyle medicine, in addition to this whole understanding of chemical exposure and environmental toxins, and gynecology and obstetrics, to help women improve women and men, and all genders and all gender expressions, help people improve their fertility and have a healthier pregnancy, an easier birth, and a healthier child, and a healthier life later on.
And that was solely online, right? But I understand that you have a follow-up 90-day program. Is that true, that you do a counseling program of some kind?
We do, absolutely.
Talk about that if you can. Tell me about that.
People can reach out to us, and we'll have a conversation to see if it's a good fit. And then it's a group coaching program, and we meet once a week. And there is, of course, the online community if you want to be part of that. But also, we meet once a week, and we go through. We have a whole series of slides and recipes, and we go through everything from how to conceive, about the menstrual cycle, to how to get into a healthy weight. All about preconception health optimization in terms of diet and optimizing nutrients, micronutrients, macronutrients, and then all the other pillars of lifestyle medicine, the sleep part and the stress reduction and exercise and removal of toxins, of course, and getting along with family and religion, having to deal with different family members and religious differences. I mean, just everything you can think of to make sure that all bases are covered so that you will have the support to get you pregnant and have a healthy pregnancy.
You have a staff of people that work with you to do that, or how does that work? Just you?
No, we're just starting, so it's just us.
Is that you and Gene? That's still you and Gene? That's still you and Gene? Okay.
Yes.
The Pregnancy Advantage was almost like a summit when I got involved in it initially. So is it still an ongoing program? Does it still go on?
Yes, absolutely. We have done one summit, And we're about to put out the second. We have another series. We have about 20 people that we've interviewed also to put out a second summit. And that will probably, Jean does all the work for that. We do the interviews together, but Jean does all the editing, which is a lot of work. So she's putting that out. We're hoping by the end of this year.
Dr. D, tell everybody the website for the Pregnancy Advantage so they know that too, because you didn't speak about that before.
It's pregnancyadvantage.net. And on that page, there's also a free giveaway on, I think, a little handout about how best to prepare for a pregnancy. So
as we sit here, you shared a lot of information. Any current major passion projects of yours? Where are you? What's going on in Debra's life now? Aside from these wonderful things, anything additional to that?
Yes. Well, I'm very lucky to work at Genentech, where they really do embrace lifestyle medicine wholeheartedly. And so I have a group, a plant-based nutrition support group that meets every month. We initially had a 6-week program that they all went through with me, and now we have this follow-up. And every month we talk about what is going well and where the little challenges are, and we really try to tweak it. Not everyone is entirely plant-based, but they're all moving along that line. And then currently we're running our third series called Live Well, Be Well, which is a lifestyle medicine program for the employees at Genentech. I do the 2 lectures on nutrition, but we also cover exercise, stress reduction, social support, and sleep, and exercise. So I think I covered them all. And so that's wonderful. And then we'll be able to take we do what they call biometrics before and after, and report back to the big bosses. And then also I can funnel those people into my support group if they want to stay. But
that's fantastic. Yeah. So is there a vision of that being able to go out into other corporate arenas? Do you see that as a potential down the road for that?
Well, this Live Well, Be Well program was designed by Premise Health. So the slide decks are all from Premise, and that's who the employer is, and they're the ones who run the clinic for Genentech. But there's some other things that are going on. I give talks at Genentech very regularly, as I I'm giving one this week called 5 a day or maybe more, where I go through the data. I'm trying to get people to eat at least 5 servings of fruits and vegetables a day, but there's data that says that maybe you should even get closer to 8 or 10. There's some wonderful data even about, not only about heart disease and stroke and heart attacks and diabetes, but also about emotional health and emotional well-being and diet and fruits and vegetables. So we're going to go through all of that. And those people also who are interested can join the support group.
I always like to ask doctors, the caregivers that they are, you're taking care of everyone else. How do you take care of you? What do you do? What's your day like?
Good question. So I did work out. It was really storming here, and normally I would just put on my boots and my umbrella and just go for a walk, but it was just too cold. I'm sort of a weather wimp. So today I just worked out on the elliptical and did that for about 45 minutes, and that was good enough. And then, but I really try to do over 10,000 steps a day, and I've done that for over a year now. I have to say I wasn't that great about exercise in the past. My father used to say when he'd come home from work and I'd be lying on the couch watching Lost in Space, and he would say, if you don't use your legs, they're going to fall off. But it's interesting as a coach, I don't scare people. I try not to use scare tactics. You really have to win them over with love and, find out what their goals are. And so I'm actually trying now to move it up closer to 5 miles a day, but it takes a lot of time. So, and I try to eat whole plant food. So, today there were some leftovers, but my happy place is a lot of berries and a huge salad with beans, different kinds of beans or grains on it, and some tofu and some, there's a great recipe for it's called tahini crack. It's from Clean Food Dirty Girl. It's just, it's tahini and a date and some lemon, and so it's really delicious. So, and
I haven't had dinner yet. You haven't had dinner yet, so this is cruel. You're turning me on. You know that, right? All right.
So, I just love I know I have to go out to dinner. This is the thing that's interesting, and I wanted to ask you and see what you do about it. But, I'm a social person, and I think a lot of us really are, and we live in a society that likes to congregate and go out and enjoy. And I remember hearing Dr. Esselstyn say there are many reasons to eat out, to be with people, to not do the dishes, blah, blah. But one reason that you eat out, one reason that you don't eat out is to damage your endothelium. Do you remember him saying that? So right. I try to keep that in mind, but it's very, very difficult unless you can go to some, some completely plant-based SOS-free restaurant. And there's an Ethiopian restaurant in Oakland that's fantastic. But most restaurants, you're going to be compromised in some way. Right. You're going to be compromised. So I do the best I can. I look at the menu first. I see what I could get. I ask for low oil, less salt, and I do the best I can. And then the next day, I eat very well. I try to eat very, very well. And so when some people say you have to be 100% SOS free, I come back and say, I think that that's honestly very difficult. Now, if I had a patient who was needing to reverse heart disease, this person had, just gone through a cabbage and they were then yes, absolutely. Esselstyn's patients, absolutely. But if you take most of my patients that I see every day for their annual exam, I'm not sure that I can justify saying you have to be 100%, plant. You have to not only plant exclusive, but you have to be 100% SOS free. Because in the real world, I'm not sure that works. But it gets me into trouble, and I might be in trouble with you now. I don't know. So how do you manage?
Debra, you can never be in trouble with me, kiddo. Here's the thing. We end up counseling people at all stages of their evolution, meaning that there are people just getting involved. There are people that have been involved over long periods of time, and everything in between. I learned a long time ago sometimes that when you try to teach people where you want them to be and not where they are, you could actually lose them from the fold. So there's a part of me that the ideal is no question that it is SOS free. But I also know that people are going to socialize. They are going to eat out. They're sometimes going to eat processed vegan products that are not ideal. So the question is, how do we love them and integrate that into keeping them on a path that we know will get them closer and closer to high level quality of health? So years ago, what I did is that if you look at many of the ethnic cultures of the world, most of them are plant-based to a great extent. So I always tell people, why reinvent the wheel? Take advantage of these ethnic cuisines before they were colonialized with all these, things for people that invaded them. And many years ago, I put out an ebook called Plant-Based Eating Out in the Real World, Plant-Based Guide to Eating Out in the Real World, where I take them to every ethnic restaurant in their community. Is it perfect? No. There's going to be salts. There's going to be oils. I talk to them about how they can maybe address reducing that. But the point is, sometimes we have to tiptoe between what we know is ideal and what we need to do with that person in real time in front of us. So I understand that dance. And I don't even like a lot of those processed vegan products. But the truth is, we're at a point now where we're bringing people into the fold with those. And there's so much trauma on this planet and in animal abuse that if I can get someone in the fold, I'm going to get them in the fold any way I can. And if it means that they eat a faux piece of cheese here or there, I'm not going to get lost in it. I will educate them that that's not ideal. But at the same time, I think we need to lighten up. And there's one thing with food that combines with everything, and that is a little bit of love. And so I like coming from that place. So when you ask me, I kind of approach it that way.
I agree. I absolutely agree. I mean, I'm married to someone who is not whole plant food, and I think we wouldn't stay together if I was insisting on always being SOS free at all times. It just wouldn't work. So I don't know. Do you have a spouse who's also?
I have a partner for 10 years that we've been separated by 4,000 miles. She lives on the southern coast of England. She does all of this work. She actually runs a business in England called the Complementary Medical Association for 30 years. She's done all the research on the evidence-based approach for this. She's written 4 books. No, so for her, she's strictly vegan. And so we've been partners for a long time. I found it very difficult not to be with someone who wasn't really on this lifestyle path. I don't even want to see them eating those foods. There's a part of that that's kind of a little bit annoying. So I don't impose it, but with Janie, we're fortunate that we have that. We share that in common.
Right.
So,
and I remember hearing.
I respect any relationship that makes it work. The bottom line.
Yeah. 28 years. 28 years. So it's a lot of time.
So I'd say that's pretty much working. You know what I'm saying? So,
right.
So Debra, as we wind down, do you have any final words that you'd like to share with the audience? Anything you'd like to share?
Well, I think, yes, I'd like to just talk for a second about this idea of salutogenesis, which is has become very important to me. I think, as you were saying before, there's a lot of trauma in the world right now, everywhere, with the environment and with human health and with gun violence and the pandemic. It is in so many different ways that we're all recovering. And I think this idea of not only just thinking about the pathogenesis of disease, which we could talk about endlessly and study into minutia, but to think about promoting health, producing health, and how do you produce a healthy society? And honestly, I think it starts before we even conceive. And so that's what the Pregnancy Advantage is all about. And that's what a lot of what I really care about is about. It's about creating health, starting even in the preconception time of life.
Well, Debra, I want to really thank you today for coming on and sharing your information, your heart, your experience, your words of wisdom. And I encourage our audience to do everything you can to follow Dr. Debra and check out the Pregnancy Advantage, check out the work that she's doing. It's remarkable work. And the information about those locations where she is will also be in our show notes, so you know that. And I really want to thank our audience out there for being part of this, because without you, we couldn't do this. And I thank you for being part of this really active, living, healthy community. On behalf of the NHA, I'm really grateful that you're with us. I'm your host, Dr. Frank Sabatino, and I really look forward to seeing you on the next episode of the Health Science Podcast.
Thank you so much.
You've been listening to the Health Science Podcast, brought to you by the National Health Association. Thank you for joining us today and for your commitment to evidence-based health science that backs a whole food, plant-exclusive lifestyle and contributes to the well-being of all people, animals, and our environment. I'm your host, Dr. Frank Sabatino. Be sure to leave a rating and a review, and we'll see you on the next show.